One of the most damaging myths and misconceptions about narcissism and psychopathy, both the traits associated with them as well as the actual full-fledged personality disorders, is that they are falsely equivalent to other mental health conditions. And that's why you have accusations of unfairly stigmatizing these disorders when people are simply talking about the research as well as the true nature of the disorder and the traits associated with these disorders. But what people who perpetuate this myth fail to realize, or they do recognize it but they don't want to accept it, is that a wealth of research links aggression and bullying to both narcissism and psychopathy. A recent meta-analysis of 437 independent studies showed the link between multiple forms of bullying and aggression and narcissism, including grandiose and vulnerable aspects of narcissism, as well as quote-unquote normal and pathological forms of narcissism. There's also been a wealth of research linking psychopathy to instrumental aggression as well as reactive aggression. Remember, instrumental aggression is more like premeditated aggression, used to meet one's agendas, needs, desires for profit or pleasure. And aside from the risk of interpersonal harm, these disorders and the traits associated with them have a very challenging prognosis. Psychopaths can actually worsen in treatment and learn better manipulation tactics in therapeutic settings, as research has found. And narcissists tend to opt out of therapy altogether because it threatens their ego when they're asked to have empathy for the needs of others and improve their behavior accordingly. But one of the biggest factors that people miss is the fact that these disorders and the associated traits tend to be ego-syntonic, which means they are highly functional and aligned with the narcissist or psychopath's ego, values, goals, and they don't disturb or cause internal distress or inner conflict in the narcissist or psychopath as much as they do in other mental health conditions. So for example, when I'm talking about borderline personality disorder, that disorder has a number of ego-dystonic traits and behaviors because the person with BPD has a goal in mind of having that relationship, but they tend to subconsciously self-sabotage, push people away, and feed into their own fear of abandonment. They inadvertently cause conflict, and this is highly distressing to them, as you can see from their attempts to engage in self-harm and reckless behavior, impulsive behavior. The distress that a person with pure BPD experiences cannot be compared to the narcissist. The narcissist doesn't experience that kind of affective empathy for others, nor do they really have a bond with people outside of seeing these interactions as transactional. They engage in behaviors that are antagonistic and intimidating and manipulative in order to meet a goal. So their traits and behaviors are aligned with their core values and their identity. Unlike someone who is experiencing psychosis or OCD, who finds repetitive compulsive actions and intrusive thoughts or hallucinations, in the cases of psychosis, alarming and disturbing and distressing, the narcissist or psychopath doesn't suffer that kind of internal conflict. It's not that they don't know that these behaviors can be dysfunctional and impairing to relationships. Most of the time it's because they simply do not care. The needs of their ego override that kind of perceived impairment. So they may know that it impairs relationships, but they just don't care enough to do anything to change it. They're all about meeting the ego, and their core personality guides them in that. So once you learn to understand that there is not as much internal distress for the narcissist or psychopath when they harm others, the distress that they experience, if any at all, is more due to their lack of achieving a goal or reward or gaining praise or an ego stroke or resources that they hope to obtain and not obtaining it. That's the kind of distress and rage that they experience, is when people don't give them what they feel entitled to get. That's different from someone with psychosis struggling mentally with their hallucinations, or someone with OCD struggling with their repetitive rituals, trying to get rid of unwanted intrusive thoughts every day. And actually what research has shown is that people with a higher number of maladaptive personality traits that overlap with narcissism or psychopathy, like manipulation and antagonism, they actually consider these traits and behaviors to be very beneficial, very functional to their life, and very effective at meeting their goals. So it actually benefits them.